Hi, I'm Lana Wells, the Brenda Stratford Chair in the Prevention of Domestic Violence in the Faculty of Social Work at the University of Calgary, and this is the School of Public Policy. Today, my co-authors and I are pleased to publish a paper with the School of Public Policy on the cost of domestic violence in Alberta. So we took a slightly different approach to analyzing domestic violence. We wanted to understand what the costs of domestic violence are in Alberta. The results were surprising. We found in the last 5 years for women who leave an abusive relationship that it costs over $600 million to support them in costs like health care, going to the doctors, employment insurance, social service programs. If there was one number that really drove this home for me today, was that every hour of every day a woman is being abused from an ex-partner or ex-spouse.
My name is Dr. Herb Emery. I'm with the School of Public Policy and I was one of the co-authors on this report. As I looked at the data, my main takeaway, even before we looked at any costs, was just the high prevalence of this as a social problem. Then attaching costs, it just sort of makes a high prevalence even more alarming to consider when you start to think that $600 million over 5 years is expended treating people who have been through just horrible situations. And we're only scratching the surface because we have not included the costs of people who are deceased. Because of these acts, we've not included things like the direct costs of the medical treatment system. In other words, we're looking at the tip of an iceberg. This is an extremely large cost. What also struck me was that we're spending a lot of money using a tradition in Canada of treating a problem and hoping it goes away. We're spending the money anyway, but what we've learned through this report is that there's strategies where we could use money differently to potentially reduce the risk downstream and reduce those costs over the long run. If we start to think about our society not as requiring expenditure but requiring investment, prevention strategies fit within the category of a social investment that can make Alberta a much better place to live.
There are solutions. What we found looking at other jurisdictions is that you can reduce prevalence and you can reduce the costs. So what our study shows is it's not that expensive. Actually, we have a 6-to-1 ratio. For every dollar we put in upstream, we're saving $6 down the road. This is public policy that Alberta can implement. I'm Lana Wells. This is the School of Public Policy. Thank you for watching.